Hi, I'm Dr. Kerry Clark, Professor of Epidemiology and Environmental Health at the University of North Florida in Jacksonville, Florida. As some of you know, I've been studying tick-borne infections for about 20 years now, and I want to say a few things about our current research. Right now we're focused on 3 areas. We're testing human subjects from across the southern states. Our primary focus is on identifying Lyme borreliosis infections, but we also do some work with other co-infections such as babesiosis and also rickettsial infections. We're ramping up a new dog study where we're obtaining samples from dogs across the southern U.S. Dogs can be a good sentinel for human tick-borne infections, so we think it's important to document what's going on in our canine companions. And we continue to test ticks that are removed from people and their pets, and look for Lyme disease as well as other tick-borne infections in those samples. We use a variety of techniques, particularly with the Lyme research. We're using culture isolation techniques as well as the newer, more sensitive molecular techniques. We've made some great progress in the last several years on the sensitivity of our detection for Lyme. And as some of you know, we're finding new species of Lyme Borrelia in human patients across the U.S. And I just want to say a few other things about the funding that we've received over the years. I want to say a special thanks to the Florida Lyme Disease Association and also to the Georgia and Alabama Lyme Disease Associations for their tremendous support. And I want to thank all of the human patients and other folks that have made private donations to our research foundation account. And I want to thank all the collaborating physicians and other healthcare providers and the veterinarians for working with us and helping us to get those samples over the years. And also want to really thank all the human patients that have provided us all these samples, and without you there's no way that we could do this work. But working together, we are obtaining some significant evidence that is going to change this landscape of tick-borne disease risk, and we're going to improve the diagnosis and treatment for Lyme disease across the southern states. And so I'm very enthusiastic about what we're doing and what we're going to obtain in terms of evidence in the coming years. And so I just want to say I appreciate all the help that we've gotten from all of you, and I look forward to working with you in the future.